I joked earlier, I think I'm going to get skin cancer from rallying for health care. You know, we have a lot to celebrate. What happened Thursday in Congress was amazing. Was amazing. But our fight is not over. Let's have a shout out, though, for those women in the Senate. Let's talk about persisting. Thanks to those Republican women that persisted regardless. And we give John McCain some shout out, and I'm all for that. But those women were early on, and they never backed up. So the moral of the story might be we need to elect more women, both locally, state, and nationally. You know, we have in Kentucky, as someone who did write the last Medicaid budget, we were making great strides under the ACA and expanded Medicaid in Kentucky. We were starting to see real progress in chronic disease among our working poor. We were seeing more and more people reaching out and getting those preventative screenings, and we were on our way. We were building the infrastructure all across this Commonwealth, not just in urban areas, but in our rural areas. The ACA and expanded Medicaid saved our rural hospitals. And now, here we are wondering what's going to happen nationally and what's that going to mean to our progress. And also, we are faced with what's going to happen on the statewide level. Governor Bevin and the Republicans in the House and Senate want to turn the corner backwards on expanded Medicaid. They are proposing a waiver that a year ago we thought had no way of being accepted by the feds, but now we're really, really afraid it does. And all of us that care about our neighbors need to be very vocal about what this 1115 waiver will do to our most vulnerable. And they'll message it just like they have everything else. Right to work, clean air. They will message it their way because they're saying everyone ought to work for their health insurance. Everyone ought to work a little bit. And that's a message that resonates. But when you look at what the hoops that folks, our poor working families, are going to have to jump through just to keep their coverage, that's not making them dignified. That's not helping them. That's not making them healthier. So we have to be very, very vigilant that when we hear those messages, and our neighbors say, oh, I work for my health insurance, they should too, we need to talk about what hoops they've run through. You know, their plan right now says that if you don't report a change in your work hours, if you're a server and you fall below 20 and you don't report that, you can be charged with Medicaid fraud. That's a criminal expense, a criminal charge, and you can be locked out of health care for 6 months before you have the opportunity to reapply, even if you are eligible. Nobody can comply with those hoops. No one. And what we know, this is not about making people more responsible, giving them their dignity. This is about money. This is about throwing people off Medicaid so we can save money as a state. Now, we can pay for the Kim Davis debacle down $250,000, but we can't afford to give people health care. It's ridiculous. We had a great victory Thursday, but our fight is still going on. Our fight goes on nationally with our senators. Thank God for Congressman John Yarmouth, who is there representing. We still have to make noise. We have to make noise at the federal building where McConnell and Rand Paul have their offices, and we have to make noise here in the state and tell people that this Bevin waiver is not good for Kentucky. It doesn't reflect Kentucky's values of taking care of our neighbors. So I hope within the next week, when you're at home, you will pick up the phone and call your state rep and your state senator and say, don't support Bevin's 1115 waiver. What we're doing now in Kentucky is good, it's very successful, and it's saving many of our medical providers, and we need to stay the course regardless of what the feds do. So thank you for coming out. Stay woke, stay involved. We can do this together. Thank you.
Representative Jenkins. Okay, I think it's time for a chant. And I think we need one that lets Mitch know how we feel about it. Hey, speaking of Senator McConnell, anybody driven down 65 in the last day or two? Seen our message to Senator McConnell on that big old billboard? Next week, look for another one. There'll be another one up next week. So if you're interested in helping fund that effort, we're trying to do this all around the state. Go to our website, indivisibleky.org, and help us out with that effort. We're trying to make a point to Senator McConnell, one way or another. Okay, so with that in mind, let's see, what's a good chant for Senator McConnell? Mitch McConnell, you can't hide. Your health care plan has been denied. Mitch McConnell, you can't hide. Your health care plan has been denied. Mitch McConnell, you can't hide. Your health care plan has been denied. One more time. Mitch McConnell, you can't hide. Your health care plan has been denied. All right. Okay, so next we want to hear from some experts and leaders in our community. We've got some providers, some healthcare experts and advocates who want to talk with us about important changes to the healthcare system and ACA to improve healthcare. I'd like to introduce right now Dr. Eli Pendleton, who's a Louisville-based family physician. Dr. Pendleton cares for a very large Medicaid population and many impoverished patients, and he understands how much the ACA has meant in his patients' lives.
Thank you, and thank you all for being here. My comments today are a little different than they would have been 2 days ago. And for that, I think that we deserve some congratulations. The war clearly has not been won, but through our presence, through our calls, through our faxes, through our emails, through our united voice, we have demanded that any healthcare reform that goes forward in this country is done in an open way that doesn't somehow put the vulnerable at risk and victimize those who have more than others. I think that one of the things that I found most important as a physician has been the open discussions that I have with patients about how I feel about healthcare reform. I remember many patients, one in particular recently, who came in and couldn't believe that I somehow supported Obamacare because, of course, somehow it was going to affect my bottom line. And I think that it's very easy to take for granted when you have health care, the tools that are available to you and to your physician to provide that health care. And it wasn't that long ago that we had hundreds of patients with no health insurance whatsoever, and all of a sudden you have a very small toolbox with which to work. And those patients have extremely restricted access to health care, and their health suffers for it. Likewise, the second conversation I just had with a patient who on Thursday was incredibly nervous about what was going to happen this week and was trying to get all of the various preventive maintenance tests lined up so that he could get them prior to losing his health care again. And he's an incredibly well-educated guy, and he said himself, it was only the fact that he was able to navigate this complex system that he was able to get the health care that he got even with his Obamacare. So we can congratulate ourselves on the efforts that we've made, but we need to refocus on our efforts locally. We know that the healthcare reform discussion will continue to play out on the national stage, but more presently, more urgently, we have the Medicare waiver coming here in the state of Kentucky. We expanded Medicaid. We expanded Medicaid to close to 500,000 people in this state. And all of a sudden I had patients who were never able to get healthy come into me and want to take responsibility for their health care, which is always the argument that's used against these sorts of programs. We need to continue to make our voices heard. We need to continue to rally against taking away quality health care and access from our patients and from you. And we need to continue to have these open conversations with your physicians. Have conversations with your neighbors. We can't just continue to scream at each other like this is just another political issue. This is our health care. This is our continued ability to work and provide for our families and contribute to this country and to this state. Health care is a right. It is not a privilege to be gained and to be lost. If we can't guarantee access to health care in this country, in this state, how are we supposed to guarantee any sort of access to life, liberty, or happiness? Thank you all for coming out today. Continue the good work. Continue spreading the good word. The fight's not over. Thank you.